with this IC. This IC is basically designed to, introduce somebody who's willing to set up a VR practice or who's thinking about setting up a VR practice. So we have a set of talks that are aimed at providing an insight into both the practice and the management part. So without further ado, I'd like to invite, I welcome my co-instructors as well, and I thank them for being a part of this IC. So there's a slight change in the order because Manoj Khatri sir is going for another session, so he'll be going first. He'll be speaking about the options in imaging. Dr. Manoj Khatri.
Good morning, everyone. First of all, let me congratulate Madan for coming up with this idea of getting insights into setting up a practice. Actually, normally nowadays we are well versed with all our training, but we don't know what to do after training and how to proceed. And we are out in the jungle, both for the patient care and as well as on the equipment purchase. And as all we know, this one modality of investigation, OCT, people have even tried, I was talking to other day with a good friend Javed Ali from LVP, and he was saying they are doing OCT as a routine even for lacrimal glands now, and also nasolacrimal duct. So OCT is an ever evolving technology, and it is making changes in both imaging as well as acquisition protocols day in and day out. No financial interest, but I was a grader for Optos 3D imaging. Why I mentioned this here is because this was the turnaround in imaging in future, which I will share with you recently in a couple of minutes. So before we decide which machine to buy, first of all, we should understand our type of practice. This is very important. Not everyone can have an access to a Heidelberg platform or a high-end Zeiss platform. We should also keep in mind what type of investment we are comfortable with. We should never allow us to be overburdened by an EMI, and also return of investment. I'm not saying the financial aspect of it, but also we should consider that the machine should pay by itself, because every year or every second year there is a software upgrade, there is a hardware upgrade, there are AMC and so on. So we should be able to break even this. All of us dream of getting an image like this before even seeing a patient, right from cornea to the optic nerve to even the choroid and sclera. But when you come in the reality, there are plethora of options, right from time domain to swept source to spectral domain and so on. So what reality also is that most of our patients, when they say, especially when it comes to a VR practice, you want to see them regularly, they are not even able to pay for your consultation, forget about the investigation. As in Tamil Nadu, we commonly call as cost illness. So coming back to the point again is there is a jungle out there, and in this jungle we need to understand where we fit our practices best and what best outcome we can generate out of it. And let's look at couple of options. I'm just going to take an example one particular disease, because we need to keep it in mind that what is your OCT is going to be used for. So if you look at the options, the best ones, definitely the gold standard ones are always Zeiss and Heidelberg platform. We can discuss the nitty-gritties as we go during the talk. When you come on the economy side one, you have Apasami, Nidec, Topcon, Optopol, and the list is endless. Nowadays, even drug manufacturing company is coming up with an OCT. However, we should always look for what type of platform you are comfortable with, which way you want to interpret your scans, whether you want a swept source platform, you want an EDI, or you just want to stick to spectral domain. OCT angio is one thing which I always recommend to everyone, because this is one of the game changers, especially in the last 4 to 5 years. The more and more we are learning about OCT angio, the more and more versatility of this machine is increasing. And also, though we are in private practice, most of us, but research do play a part. So why I put a question mark here is, even if it is a small scale research, you want to publish some data with image acquisition, you need to have a good platform. You cannot have a Apasami machine and tend to do research. So these are a couple of points which one needs to keep in mind. before committing yourself to any kind of a pharma company. Let's take an example of only one disease. As we know, this has undergone sea change. There was so many importance of biomarkers over a period of time, with so much of diagnostic modality available for neovascular AMD or any kind of macular degeneration. And these biomarkers have changed over a period of time. But the major game changer of understanding this particular disease was OCT. So this we have to keep it in mind. And this has been published over a period of time. The technology has evolved over a period of time we all are familiar with. But what has also changed with the newer imaging modalities is the era of SWIFT spores and EDI OCT. Why we keep this point in mind is, even if you are not having the technology, you can refer this patient just to get an image acquisition done at that particular center where this technology is available, and then we can prognosticate or treat these patients in a better way. So I don't have to stress the importance of what is the need of OCT in current practice, but now the imaging acquisition has gone even beyond a sub-micron level. Initially we were thinking, okay, 8 microns, 10 microns is good. Now then we thought 5 to 6 microns is good. Now we are talking about in terms of sub-micron analysis. So this becomes very, very critical, and over a period of time this biomarker has changed. We just take an example of serous. I have a pleasure of in our practice about 8 different machines of different platforms, but most commonly out of 8 there are 3 are serous machines. So serous is what we commonly use, serous 5000 in that. But recently we just had to change the laser head of the software, the laser head of the machine, and in spite of having an AMC with us, we realized that the cost of the laser head was about 6.5 lakhs. So these things we have to keep it in mind. I'm not going to go in details. As I said, this is a mixed talk between the commercial aspect and also the visualization, what all the machine can offer. So these things we have to keep it very well in our mind. One, we are having the technology, but what is the revenue side of it? How much we can generate? And we cannot overcharge this patient. We cannot overburden our patient. I have OCT angio and I'm going to charge you X amount. That is not possible. So that is not possible even at the institute level and even in private practice. So these two things which we have to keep it in mind. And now what has changed over a period of time with any kind of high-end imaging machine is not only seeing these disorders at the different interface levels, but also what has changed is the dynamics of OCT angio. So OCT angio is going to be the standard norm of clinical practice. One example I'll just like to share here is a kind of this patient who presented with neovascular AMD, was on treatment over a period of time, and what you can see here is an OCT angio overlay of on a fundus fluorescein angiogram, and OCT angio doesn't miss out anything. The only problem here is we have to go to the machine and look at the different protocols, different acquisition scans, what has been taken, and take this imaging modality to a different level. Couple of other considerations also come into the mind when we look at all these patients are how far the technology can be interpreted by us as well. So it's not that you have taken the machine and the machine is going to tell you all the things. So we also keep this thing in mind. And with newer technologies like home OCT, again we have done this for about 3 patients or so in our clinical practice for patients who are immobile due to COVID related problems. And this is a very promising tool. What you can see here is a comparison of a home OCT image here, and this is a standard OCT what we are all familiar with. And at this juncture, Novartis is very kind that they are not charging anything on the imaging part for the patient. So this kind of things are going to be the future. So OCT, as I said, the plethora of imaging is going to move even forward, and AI is going to come in a very big way, which is going to tell you even the treatment schedule and what all you are going to offer to your particular patients. OCT A here is here to stay. Again and again I'm mentioning this, especially on the Swift Floor platform. And there are so many varieties of OCTs now, pediatric OCTs. I think Mohit is here and he will agree that he needs this in this practice. You cannot do, go away without doing pediatric OCTs nowadays, intraoperative OCTs, and there are so many advances which are happening. But again, the bottom line is we should know what we want from our practice and what all we can do with that imaging modalities. Not every one of us can be fortunate enough to have all these technologies at their disposal and then use it. And even if you have the technology, I had a demo of intraoperative OCT. In spite of having so many years of experience, I was not at all comfortable using it. So we should also be aware of our limitations as well. It's not that you want this technology and that machine. So what we look at in the future is going to become a reality. We want a single machine which satisfies all these criteria, right from fundus photography to FA, ICG if required. And 3D imaging is going to come in a big way with wide field end-to-end aura to aura imaging of OCT. So what I want to convey today is, though Madan told me like, you give us the messages which machine to buy, which one not to buy. I will go on the flip side of it and I will say, buy what is comfortable to your practice. And don't ever fall prey to pharma companies' hands, especially when there is a EMI burden, the practice pattern changes, which we have seen in a couple of centers happening, and that should not be your goal. Thank you so very much for a patient hearing and giving this opportunity, and thank you, Madan, for organizing this.
Thank you, sir. Thank you. The message is well taken. So just one question that I'd like to put across when we're talking about imaging for the benefit of anybody who's going to start. You've spoken so much about OCTs and OCT angiography and fundus photography. What is the role of FFA today? I mean, I understand the research part, but if somebody is going to start out, where in the priority list does an FFA machine fit in?
Still has a very big role. Still has a very big role, especially when you have patients with CSR. And AMD which is not fitting the general criteria. We have a huge chunk of IPCV patients, so FA ICG definitely has a role. In fact, we had a privilege in a city like Chennai. There's only center in the private practice who has ICG, apart from the institute. So most of the centers don't even talk about ICG, but the FA ICG definitely still has a role. OCT angio, though it is it's a complementary technology, I will say, and it has a long way to go still. It's an evolving technology, and we also have to learn a lot many things before we start interpreting it very comfortably.
Thank you, sir. Thank you.
Thank you, Madan.
Once again, this was supposed to be the first talk where I give an outlay and an overview about the principles and practice of setting up a new VR practice. So at the outset, I'll state that this is in no way trying to say that having your own practice is the best way to do it, or that is the end goal or anything like that. People are comfortable in institutes or in charity hospitals, so each one to his own. But this instruction course, it was designed to give an idea to somebody who wants to start out, to talk about the nitty-gritties, to talk about the finances, to talk about the options. So when you talk about your own practice, the first question that comes up is, why? We are comfortable in institutes, but why would you even think of owning your own practice? The point is that you have the opportunity to provide growth to yourself and to people around you. You can change the economy around you, you can influence the community around you, and you can be an agent of change. And that is something that you can do when you have your own practice. But for that, you need to think differently from day one. As they say, the eye cannot see what the mind does not know. So you need to think and act like an owner from an early age. I would say from the days of your residency, you need to see everything differently and question things, by which I mean that, question the small things in your institute, in your place of work. Why is something placed where it is? What is the role of a particular person? Can that role be done differently? So you begin to question everything. You think like the owner, you take up responsibility. And when working in an institute, it's always natural that, I have my fellows who say, no, sir, I'd like to work with the Lumira 700 alone. That's where I can see. I say, no, you work with the Lumira, you work with the Topcon. Work with different ranges of machines, know them well, and you need to know what the value of money it offers. Let's say there is a machine that costs 20 lakhs. There is the same machine that costs 10 lakhs. So you have a difference of 10 lakhs, but what is the value that the 10 lakh difference is going to give you, and we need to be very clear about that. Talk to your consultants or your assistants or your professors in your residency days and know the difference, know the value for money. And something that we don't concentrate on until we buy a machine is the operating costs. So just getting a machine is not the end of the story. It's going to give you recurring expenditure. It's going to give you consumables like cassettes and tubings and so on and so forth. So you'll have to be comfortable. You need to know the operating costs of a particular machine. And then after coming out of an institute, real world experience counts a lot. By which I mean, you know, our institutes are really huge and we are a small part in that big chain. But when you come out, you need to work in, or you know, get experience in a place, in a scale that you envision for yourself. If you think that, you know, I'd like to have this kind of a setup, go work there. See how they actually multitask, because in an institute, multitasking may not have been there. You'll have specified people for specified roles. So in a private practice, in a small setup or in a startup, multitasking is very important, and that's where you can manage costs. So you need to have real world experience. And coming to money, it's a touchy topic for most of us, but especially when you're starting out, you need to have an honest discussion with family, sit down and see what they have and what they can contribute towards our startup. We'll usually be surprised by what we have, or actually what we don't have. And if the expectations don't match, then you begin to talk about, you know, going out for a loan. What are the interest rates? What are the collaterals that you'll need? What is your CIBIL score? And if all of this is not matching, then you might think of unsecured loans from your friends or relatives. And this is something that I'd like to stress upon. You know, the economic impact of our actions. As doctors, we're not really aware of the economic impact of the actions and what we do. So I'd like to say that the charges that we charge a patient are X and our expenses are Y. The difference between X and Y is what is going to run the show. X is usually determined by the market. We can't play with X much, but Y is something that we can tweak around, that we can optimize. So doing the optimization in Y is going to give your revenue. So you need to know the costs involved in a particular surgery, and you'll have to be very, very clear about the consumables used, be it on a large scale or on a small scale. That is going to give you your revenue. Then I say network with people, you know, build lasting relationships. I have learned the science of ophthalmology from doctors and senior professors, well-respected people. But I've learned the business of ophthalmology from a lot of other people, right from the watchman at the door to the OT technician, to, from an unhappy patient to the aggressive, you know, insurance guy who wants to squeeze us. So everybody has something to teach us. We'll have to keep our mind open and learn from everybody, and that's very, very important for a startup. And besides the science, you need to know your infrastructure, tools, and quick fixes for everything. For example, the last week I was operating on a VR case. The power went off. The guy who was supposed to be there switching on the generator was not available. So I had to stop, I had to go out, switch on the generator, come back in. Now that's not the ideal thing to do, but you'll have to know, and you'll have to be the last man who will at least do and get the job done, because the show should go on. I remember about 20-25 years back when my dad taught me how to ride a bike. The first thing he taught me was how to fix a flat tire. Only then he taught me how to ride a bike. So you need to know quick fixes because the show should go on. Man management skills are very important. I say, you know, hire for aptitude and then train for skill. We'll have to adapt to changing needs, and in that process we'll be losing a few people. That's okay. We ourselves will have to unlearn and relearn a lot of things, and that's something that we don't do because you know, unlearning and relearning becomes difficult with age. The entire drive is that, you know, leadership is about vision and responsibility. You're creating something, so that drive would always be there. When it comes to hierarchy, the needs and priorities of the organization are paramount. The needs and priorities of the organization are paramount. Then the employee, take care of your employee, the employee will take care of your client. Finally, the leader comes. The leader is the first to step in case there's an adversity, and he's the last to take credit for anything that goes well. These 4 A's are something that I stress upon always when we're talking about a medical practice, in that order: accessibility, availability, affordability, and appropriateness. Now we'd like to think that, you know, something that we do is very unique, for example a phaco or a VR surgery, but if we step back and think, you know, it's not that unique. Anybody can do what I'm doing. Given he's got adequate training, moderate training, he can do what I'm doing, and 6 days after surgery the results are also, you know, more or less equal. So what I'm doing, anybody can do. So look at it from the patient's perspective. I'd like to approach this doctor if he's accessible, if I can go and approach him from my home without too much hassles, if he's available most of the time. So these two would rank really high. And if there is one thing that a business leader or somebody into business will tell to you about retail services, that is location. Location, location, location. You need to know where you're sitting. You are selling a product, and does the community in that location need your product? It's called the product market fit. Does your product fit with the needs of the market there? So in analyzing this, it's important to remember that it's okay if you move out of your comfort zone. This is not about our interests or where I want to be. It's about the organization again. The organization should grow, and so the product that is sold by the organization has to be in the right place. Finally, we are in the business of dealing with people. So the person sitting across the table, he's not interested in knowing my scientific degrees, knowing what all I can do. He is interested to know if I can help him, if I can, help him alleviate his suffering, if I am genuine. So how genuine am I? And the best way to do that is to listen. Because the needs, perspectives, the thinking of people in different communities are different. So I need to understand that. I need to understand what his needs are, and in doing that, I need to listen to him. When I listen to what he's saying, I know what he wants. When I know what he wants, I can, give him relevant solutions, comprehensive solutions in a holistic manner, and that's what most of our patients want. And when you do this on a consistent basis, word gets around, your practice grows, and when you are self-sufficient, you can come back to science. Science and academia then form the icing on a well-baked cake. So time is the real currency. I'd like to stress this. Time is the real currency and our most valuable asset. So when you own your practice or when you have your own setup, you have your own, you control your most valuable asset, and you go through a lot of trials and tribulations that makes you a better person, both physically and mentally, and you carry that forward into other spheres of your life. So I'd like to close with this, line in Tamil from the Masters of Tamil Music. It says, Pudu Ragam Padaipadale Nanum Irevane. A loose translation would be, if somebody who creates is God, then I'm God. Well, that's a little too extreme, but you can say that, you have the satisfaction of creating something and being known after you've gone for the values that you stood for, giving people opportunities. So the most reliable way to predict the future is to create it. And so welcome to the world of entrepreneurship. Thank you. I'd like to call my next speaker. Probably we'll have the questions at the end. Nagesh would come next.
Good morning. At the outset, I thank IOC and Madan for providing me to be a part of this instruction course. My topic will be on the lasers and the delivery system. I'll try to keep my slides very, very straightforward and very, very practical approach, right? So I don't have any financial interest. So if you look at the plethora of machines, the laser delivery systems that is available in the market, probably many people might be very well versed with JICE, and then Iridex, and then of course APA, Aerolab, Quantil, we have Navilas, and then Lightmet. There are a lot of machines are available with a lot range of different wavelengths and different delivery systems and different modes are available. So I'll try to touch upon the each and individual laser machines available and what are the additional advantage over one over the others. So if you look at the first thing that we need to look at whenever we want to buy a laser machine should be either you want to buy a simple green one, the conventional one which is very, very familiar with, or if you want to go with an yellow laser, or we have a red or the diode. As you know, at this point of time, the yellow laser is coming up in a big way because of the reason that it has very least toxic effect on the macula. Suppose someone want to have more work, or you want to do a laser more in exudative maculopathy disorders, probably yellow laser should be a best option for us, and provide along with that we have a micropulse technology also. So yellow laser with a micropulse technology would be a best option if you have the patient load who have more often have the macular disorders. Otherwise, routine or conventionally we keep doing with the green lasers. And of course, diode laser also we can have it, especially in the OT setups. And if you look at the delivery systems, conventionally, and majority of the companies do have the slit lamp delivery system. And additionally, we can have either LIO or we can have endo probes. And few companies have come up with attachments where you have a slit lamp at your OPD, you can attach with the laser system to the existing OPD slit lamp. So just we need to check the models which is compatible with the slit lamp laser adapters. It's hardly a 5-minute job where the company people will come and attach the laser unit to your existing slit lamp, so that you can use the slit lamp as both as a diagnostic as well as therapeutic. So it decreases your cost of having a separate slit lamp unit as well. And then there are a few machines which come with a simple single spot, and then nowadays all the machines are getting upgraded, and you have option of upgrading from the single spot lasers to a multi-spot lasers, and even there are a few pattern spot lasers, and all these things are continuous lasers. And then nowadays we have a micropulse technology where the energy delivery will be very, very precise, and it will be very, very fraction of seconds, so that will cause a less tissue damage. So that is a technology where micropulse is playing a play. Now the machinists have come up with both green laser micropulse as well as yellow laser micropulse. The option is left to us whether to choose for the micropulse, yellow laser or the green laser as well. And of course, even the micropulse comes with a single spot, and it comes with a multi-spot or in a customized pattern as well. So to be what are the things that we need to keep in mind when you want to buy a laser machine? So first of all, it is a turnover of the patients, and then the turnover of the patients who need lasers, whether it is a focal laser or it is a pan-retinal photocoagulation, and whether you want to use the laser machines for the OPD and OT altogether, or it's only the OPD practice that you are most of the times you are busy with, or it is a multi-stational utility, whether you want to carry the laser machine to different setups where you might be having a practices in different places, 2-3 places. If you want to carry it as like a portable slit laser machines, that is one thing you need to keep in mind before deciding which laser to be buy. And of course, accessories, services, AMC, CMC maintenance are quite different for different brands. Of course, the Indian brands, the services, accessories, always it will be cheaper than the foreign brands. That is one thing we need to keep in mind. And then the ports. So usually the console of the laser will have a ports where you will have a single port or double port, where you will be attaching the slit lamp laser cable to the single port, or if you have a double port, you can attach the slit lamp cable to the one port and then LIO to the other port. So that will avoid you to keep changing your ports again and again. So that increases the longevity of the cables, because the cables again, once it get damaged, you will be spending again 1 to 2 lakhs rupees on the cable itself. So before buying the machine, probably you need to look at whether the console has double ports or the single ports. That's the one thing important. Of course, at the end, everything boils down to the cost. So we always keep looking at the lowest cost of the machines which are available. So I'll just briefly touch upon the different companies which have uniqueness compared to the other one. The Visualas, either you will get, this is the classic model and the comfort model, where you can upgrade the comfort model from the single spot to multi-spot. They have again single port and double port. And then VisualLink is something like an adapter where you can use that adapter for existing slit lamp. And of course, the console is very, very smaller and it is portable. Now it is called as Visualas Green because it was Visualas S. Iridex is the one company which is exclusively towards the laser. They have all kind of lasers starting from single port, multi, micropulse, both in the green and yellow. And of course, console is very, very portable. And of course, is somewhere around starting from 30 lakhs to 50 lakhs. And in a cheaper, the economical models, we have Apaswamy, where they have a single sun multi-spot, they have a slit lamp and an LIO. And then console, of course, it is fixed to the chair unit. You can't, it can't be portable to the OT and all those things. The cost will be off of the cost of the previously mentioned slit lamps. We have exclusively yellow lasers, the Quantals, where they have single, multi, and sub-threshold spots. Again, the console is fixed to the slit lamp. It can't be portable. This is exclusively yellow lasers, where if you are really fascinated about treating the macular disorders and all, probably this should be the one of the choice. Of course, again, the cost will go up with this one. And we have Aurolab, Aurolace. Again, this will be a more economical one. They have This again, it is a portable. We can carry this to the both OPD and the OT, and they have a slit lamp adapters as well. So it can be fixed to the all newer models of diagnostic slit lamp that is there in your OPDs. Again, LightMed, again, it has both green, laser, infrared, diode, all kinds of available depending upon the money what we are spending on it. And apart from that, we have accessories that we need to keep in mind. Majority of the companies, they give this either focal and pan-retinal lasers, and most of these things have inbuilt transformers, so you don't need to be worried about the power flow. And all these laser machines do work with a single phase 10 amperes current. That is more than enough, right? So at our set we have so many options like yellow, green, red diode, single port, pattern, micropulse, and how it matters. So what are things what it decides to go about. If you look at the literature about all these laser systems, so much about the literature talked about the laser running time, patient comfort, laser precision. Of course, they are really matters, but they are very, very minor when you want to buy a laser machine for your private setup. And of course, predominantly, if you are working on the macular disorders or the extramacular disorders, again, that will decide whether you want to go exclusively for the yellow lasers, the green lasers. And at the end, the cost, it matters. So probably that is the reason why you want to go with a single one, or the combo, or the fixed or portable one. And so looking at the finance part, of course, the laser workstation stands lost in the finance part. We will be catering only 5 to 8% of your budget for the lasers. That is what you need to keep in mind before setting up a laser workstation. If you look at the hierarchy of the value added laser workstation, probably you need to check it locally whether you have a circulating laser systems where a person will be traveling that laser machine in his van to different hospitals. Probably that is what you need to work out. If at all you are not ready to buy a workstation, and it will work out very, very cheaply. And probably if you can have a single slit lamp adapters, if your slit lamp is compatible with the company's models. And the next hierarchy will be a simple green single spot laser that comes from 12 to 15 lakhs. And then even you can have LAO as attachment, or you can you may not be having LAO. That also comes down your cost by 2 to 2.5 lakhs. Then a multi-spot, again, it adds up around 10 lakhs extra for your single spot. Then the pattern laser and the micropulse delivery, again, it adds up around 5 to 6 lakhs extra for you. And the budget is not a constraint. Probably you can go for the combi lasers where you have retinal lasers along with the YAG laser. All in one, it will come together. But again, the cost will go up to around 50 to 60 lakhs rupees. So that's how. So probably this is how we need to work on for the lasers, because it may not be a main part of our armamentarium in private practice, but still for the least cost, probably we'll be getting your work done. Okay, thank you. Yeah.
Thank you, Nagesh. Thank you. Extensively covered. I will now invite Dr. Veer to talk about microscopes, biomes, and machines. We'll probably take a few questions at the end if we have time.
Good morning, everyone. So thanks, Madan and Nishat, for having me here. So I come from one of the oldest surgical retina centers of Punjab. So when Nishat asked me to do this topic, I was more than happy because I've seen from the worst to the best, from the cheapest to the most expensive. So I'll try to give a very unbiased opinion about what you can do in your OR when it comes to setting up a new practice for a new person. So first thing, coming to the microscopes. So I think if you're planning a pure retina practice, the basic requirements that you need is an XY coupling, a continuous zoom, and a side scope for your assistants and your fellows to learn. So these are the three basic requirements that you need for a VR microscope. So of course, when it's a new person, you're looking at budget options. So you can go for either a Leica M620 or an OMS 800 basic. Zeiss has options like the 300 and the Lumera I if you're looking for a slightly extended budget. And of course, you have advanced options as well, from a Lumera T to the Lumera 700, in which everything is automatic with the biome systems and everything. Leica comes with the options of an 822, 844 and the high-end Provio 8. Hark Street also has an option, Neo 900. Alcon has its microscopes, which are the Luxor LX3 and the newly launched Revelia. I personally have the OMS 800 top-end office system, and I'll come to that a little later. And of course, if budget is not the option, then of course you have 3D systems, which are the Ingenuity and the Zeiss Artivo 800. Coming to the viewing systems. Viewing systems, they are basically two types. They can be either a contact viewing system or a non-contact viewing system. In contact viewing systems, further, there are direct vitrectomy lenses and there are indirect vitrectomy lenses. In direct vitrectomy lenses, they form basically an erect image, and they come with a combination of prisms and flat lenses along with a ring, which is called the Lander's vitrectomy system. You have to suture the rings, or even there are non-suturable rings available now, and you have to use different rings to see different parts of the retina. It's quite a cumbersome procedure working with this. I've seen this happening, but personally I'm not a big fan of it. Indirect vitrectomy lenses are, this is the catalog from VOC. So they're wide range of wide field lenses and central retinal lenses. I'll just come to them one by one. Of course, with the indirect lenses and the indirect viewing systems, you have inverted images, so you'll need an inverters. The Oculus one and the VOC one are popular choices. In wide field lenses, the HRX vitrectomy lens or the Mini Quad XL are the most commonly used, and they give a very wide view for vitrectomy, and you can see up to the aura very comfortably. And of course, there's a Mini Quad previous generation as well, and the DynaView, which is mainly used for pediatric surgeries. Central retinal and the supermacula are mainly basically both used for macular work and up to the mid periphery. The central retina gives a slightly wider view. Non-contact viewing systems are the most popular ones these days, and I think most of us newer generation people are trained on these. The popular options are the Zeiss Resight, Oculus Biome, VOC Merlin, Topcon Office, Hark Street, iBoss, and Leica RUV. So Zeiss happens to be one of the most popular amongst the younger generation, probably because of the ease of use. It comes in two models, which is the 500 and the 700. The 500 is the manual one and the 700 is the automatic one. The only downside is it can't be used with any other microscope. It's only used with Zeiss microscopes. It comes with basically two lenses. One is the yellow lens, which is the wide field lens, and the green lens, which is the macular lens. It's a 60 diopter lens. Oculus is one of my favorites because of sheerly the ease of use and the quality it offers. The most favorite part here is the golden lens which they offer, which is actually a combination of a macular plus a wide field. And you can do all maneuvers with this. Of course, they have the other range of a wide field 120 lens with a mid fields 90 and a macula 6 and a small pediatric lens as well. Merlin system is very similar to the Oculus system. It offers a wide field lens, a mid field lens, and a small lens for pediatric surgeries. The Topcon, this is what I have. It offers a wide range of lenses from 40 high macular lenses to 80 midfield lenses and 120, and each offered in a small and a big variant. But personally, I only use two lenses, which is the 120 wide field lens and the 80. And most of the maneuvers, even ILM peeling, everything can be done very comfortably with the 80 lens. So these I've kept together and they're a little different. Why so? Because iBoss, Hark Street iBoss and the Leica RUV do not require an inverter. And they have an inbuilt inverter and the lenses are slightly different. And again, they also come with a wide field and a mid field or a macular 90 lens. Coming to the most important and the last part of this, vitrectomy machines. Vitrectomy machines can range from very little to the sky is the limit. And in Indian budget options, they are good machines. And of course, if you're looking for an imported, if you're looking for the idea is if you're looking for a very basic setup and you're doing mainly a cataract practice, and you want to do simple VR procedures, I guess an Indian machine is good. And we've used the Reticare for quite a few years. And Appa saw me recently come up with the Galaxy robot, which I've heard good things about. But then again, the pros of these machines are they are cheaper, yes, and they get the job done. The running cost is also less. But the cons are they're quite less efficient when compared to the high-end machines. They're cumbersome to use, and they have slightly inferior quality and functioning. And if you're looking for a pure VR setup and you want to do full-fledged VR work, I would really recommend a high-end imported machine. And the most popular options are the Alcon Constellation, the Bosch & Lomb Stellaris, and the Dork EVA. There are other options as well, which is the Goider Megatron, Earthly OS4, Opticon Revolution. Nishat has that, and I think he can give you a little insight on that. The pros of these machines are their excellent quality and functioning, very efficient, easy to use, but of course at the end of the day it boils down to the pocket, and they're expensive. So I personally have the Alcon with the PurePoint laser, so I'm going to be just mentioning a few key favorites of what I like about this machine. First of all, it has excellent vitrectomy cutters with extremely predictable and controlled cutting and suction. Their Troca cannula systems are excellent. The light source, personally having used Reticare for so many years, there is a huge difference between what the light in the Reticare is and what the Constellation offers. And even the chandelier is a beautiful accessory here. I love the IOP control functions, how you can steadily work on a certain IOP, say 30 millimeters, and with just a press of a foot switch button, you can go up to 60. It's very useful in these PDR surgeries to control the bleeds and wherever you would like to play around. It has a very good stability. And they constantly keep advancing their cutters, and they have machine upgrades. And their service is excellent. The person will keep coming and upgrading a machine. For instance, they've had the 10K cutter. The 20K has been going around in research, but they're going to launch that as well. And I personally love the beveled cutter for the PDR surgeries. And another added advantage is it has an excellent phaco. You get the infinity handpiece in this. And I personally, being a Retina plus I do cataract as well. I do all my cataracts on this, and I love doing cataract on Constellation. And of course, the instruments with the Grishaber part are also excellent. And the PurePoint laser here offers great quality. The curved laser probes are just excellent. And with one hand, you can do almost 70 to 80% of your laser. So this is what don't mind the wires everywhere. This is what my surgical station looks like. So on the left side, you can see there's a GA workstation with the pulse ox. The OMS 800 is there and the foot switches are down underneath. And you can see the biome part, which is the office system, which is attached there. The Constellation on the right side with the PurePoint and the surgical tray. And I record most of my surgeries. So we have two identical systems of the exact same thing, because we have more than one surgeons. This is what it looks like when I'm operating. There are two trays which are prepared. One is for the instruments that I need continuously, and the other ones are where I need some backup instruments, say dyes, lenses, and other things. And usually I have a fellow who's assisting me and who's learning from the side scope, and a OR sister that is usually assisting me. So with that, I'd like to conclude, and thank you.
Thanks, Veer. That was a comprehensive talk. Thank you. I'd like to invite Dr. Nishat to talk about ROP and setting up an ROP practice.
A very good morning to all. I'll be talking about how to set up a ROP practice. These will be the topics which I'll be covering. Setting up ROP practice is not for everybody. It's a person who has a particular interest in doing ROP, only beneficial for them. So I will be covering for the training part, equipment, tie-ups, documentation, indemnity required if you are doing ROP, and how ROP has helped me in my private practice, and message. So before starting ROP, a good training is very much important. We cannot touch a baby with ROP or do ROP screening if we don't have a proper training. There are many good institutes in our country where we can have ROP training, and if possible to have hands-on laser on them, and if possible few intravitreal injections also in ROP, it can be possible at these training institutes. In the starting, if we are starting ROP, at least to start with medical ROP, to start with lasers and anti-VEGFs. Surgery I am not doing. And it's also important to attend regular webinars, ROP CMEs and ROP conferences to keep oneself updated with what is going on in ROP. We get to learn so many things. And also, if we are planning to start a ROP practice, it is better to become a member of a ROP society. There's a WhatsApp group in which a lot of queries are there, and we get to learn so many things from those queries. Proper equipment is also required before we start doing ROP practice. Indirect ophthalmoscope, as it's a VR practice, most of us already have a indirect ophthalmoscope. We can use 20 diopter lens, 28 diopter lens, speculum, indenter or a wire vertis, green laser. Many people have green laser, but when I started my private practice, along with the green laser, I purchased LIO at that very time because I was clear that I have to do ROP practice. So whenever we are buying a green laser, we have to keep that in mind. As Nagesh was telling, many laser machines are not portable. So we have to think about it before buying green laser. And I have a dedicated staff who handles my green laser and LIO attachments for it. So this is how the ROP equipment looks like. This is the speculum, wire vertis. Anybody who's comfortable with 20 diopter lens or a 28 diopter lens, and the drops, the anesthetic drops, lubricatings, and dilating ROP semi-drops. And this is my ROP bag with the indirect ophthalmoscope, the sterilized equipment, 28 lens, eye drops, spare battery. It's a battery operated, not a wire operated. Spare battery is there. My different color pencils and my ROP file for documentations. This is a small video. I have a dedicated staff who's arranging my this laser console. He carefully puts everything in that, because this is the main part. Anything breakage, it will cost very heavily to the doctor. This is how the laser is packed. It's a mid-size bag. This is very important for a LIO cable. It has a fiber optic, and handling it is very important. No sharp bends are given in the handling of the LIO cable. And this is my indirect ophthalmoscope bag. And he's the same person who, whenever I'm doing ROP, this is my equipment for the ROP laser. And this is the same person who, wherever I go to the NICO, he is the person who installs the laser for me. He is the only person who's handling my laser. So a little about intravitreal, how I gave intravitreal injections in ROP. Normally we wrap a baby nicely because the VR OT can be really very cold. It is very important to wrap the baby nicely and keep the baby warm, because these babies go for hypothermia. A little forward. These are the things required for giving intravitreal injections. Single adult drape which we are using, phaco, can be fixed on both the eyes together. Some Parakin eye drops. This is the dose, 0.02 ml of, I usually use Avastin. It is stabilized with the bud. and the tip is aiming towards the optic nerve. And my assistant is pressing the plunger to give the injection, to inject the dose. And a few drops of betadine are put. Similarly, it is repeated on the other side. We change the gloves, both the assistant and the surgeon. The injection is given. And always examine the baby next day post the injection. It is very important when we are starting ROP practice, we should tie up with various NICUs around the city. We should know which are the level 3 NICUs are available, and we should just go and meet them, the pediatricians and the neonatologists, and explore the options of doing ROP practice in their hospital. I usually don't tell them to send the babies to me. I just go to their NICUs and examine the babies. And we have to build a good rapport with all the neonatologists and the pediatricians. Many government hospitals, they don't have ROP specialists, so they also come up with various schemes, and they sometimes outsource ROP specialists. And also we can organize various CMEs. The big hospitals or the corporates, they have a boardroom, so we can always arrange small CMEs in there so that they know that you're doing a lot of ROP. This is one of the most important things, like having proper documentation and record keeping. And this RBSK booklet, which I'll be showing next, is very important. One should go in detail with that book. There's a ROP screening form is also available. One can just take a printout and modify according to his needs. And before doing ROP practice, we should be ready with all these consent forms for screening, for laser, for anti-VEGF injections. These can be downloaded from AIOS or DOS consents. This is the RBSK booklet, which shows the universal eye screening, and it covers ROP also. This is the ROP form, recording form, which is there. It has a follow-up form also, and this can be modified according to yourself. And this is the DOS consents, which shows the ROP laser and anti-VEGF consent form. This is another important point, medical indemnity. If you are doing ROP, you should have an indemnity. I personally have of 20 lakhs because I don't operate ROP cases, but seniors suggest, like, if you are operating also, minimum indemnity should be of a 2 BHK apartment in your area of practicing. And how ROP has helped me in growing my private practice. Like when I'm visiting so many NICUs, I get to meet so many doctors, staff. It builds up a networking over there. And once ROP babies are discharged from the NICUs, then they, for subsequent follow-ups, they can send to me. And not only for ROP, they can send other babies or other eye-related problems for refractive errors, cataracts also to me during follow-ups. So the take-home message is, when in doubt for ROP, don't hesitate to refer to higher center or take a second opinion. And counseling is very important for screening as well as treatment. Spend some time with the parents for counseling, and keep updated with ROP literature. What is the latest treatment going on for ROP and latest nomenclature, what is there, it's recently come out. And if possible, draw diagrams or take photographs. We can take a photograph with the mobile. There are so many portable cameras which are available. It's always beneficial to have them. Thank you.
Thanks, Nishad. Comprehensive talk indeed. So I think we're just on time to hand over to the next session. If there are a couple of questions, I think we can probably take them.
How do you manage the packs for vitrectomy? How do you recycle?
Honestly, I don't use packs, sir. The Alcon ones, I assume you're talking about the Alcon packs. I use the Apasami ones where I don't get the packs as such. It's just the cutters, and more importantly, the light pipes and trocars, they last longer. And the cutters, they usually come for 10 cases. And if it's inefficient, then I replace them. For a maximum of 10 cases, I can use a cutter, the mid-lab cutter. Yeah, Nagesh. No, that's a very nice question that he's asked. The question that's being asked is that the resite biome is one that all of us are familiar with. Can it be fixed only to Zeiss microscopes or to other microscopes as well? So as far as my understanding goes, you can fix the resite only to Zeiss microscopes, and you have other microscopes, as Veer was talking about. There are other microscopes, there are other biomes. The problem is once you go out of their make, they're not compatible. I had a really bad experience where I had a microscope of one. Both of them are really costly, the microscope and the biome, but they simply didn't go together. And all that the company people will tell you is, sir, it's like this. This is how it is. You will see rings and you'll see scotomas here and there. But the only thing that they say before they make the sale is that, sir, it's perfectly compatible. He's using it and she's using it and all that. But once it is fixed and you see all these rings and all, then they say, sir, it's like this. This is how it is. Everybody operates like this. It's not how it should be. You should get a good view. And my personal suggestion is, if you're buying a microscope and if you're buying a biome from a different company, make sure you see it being used in practice. And I did that the second time around. In my second center, I did that and then purchased it. Yeah. And the point is, they are a little hesitant to give a demo from two different companies, That would make sense if you can actually see it working.
How you sterilize these biomes? Whether you will heat it or how you do that?
So the ones I use are autoclavable, and they have.
No, that's the question asked of Veer was that what are the biomes that are autoclavable and what are the biomes that cannot be autoclaved?
So usually, since I have the ones that are autoclavable, we autoclave them after case.
Right.
And they have specific instructions at what temperatures and how it is to be done, cycle and everything. So if you follow that, usually you're okay. But since we're doing a lot of surgical retina practice, we have multiple sets as well.
Right.
So that we can EPO them, and then the autoclavable cycles can be
Reduced.
and their life can be prolonged.
Right. It makes sense to ask this query before purchasing, because there are a lot of biomes that cannot be autoclaved, and suppose you have a case today and you have a case tomorrow as well, you need two biomes then if the biome has to go for an ETO. So it's good to have this knowledge beforehand, especially for a startup. So thank you all for attending. I'll like to hand over to the next session.